That's it there.
Whatever you've been going through, we can talk about it. We ain't passing no judgment. Don't be ashamed. It's all the same. Stay in your lane.
Okay.
Your lane. It's whatever you're
John's Family Medicine, everyone, Skin Solution, Kerry. That's it, right?
And the others, when they have the actual
Alright.
ads, that's the giveaways and stuff.
Okay.
Just don't be afraid of your heart. Don't be ashamed. It's on the same thing in your lane. Your lane. It's whatever you're feeling. Stay in your lane. Come on, the dark and don't be ashamed. Your lane. Let's have a conversation on what we face every day. Your lane's our show with Coach Trish Hannah.
Hello, and welcome everyone to Your Lane Talk Show with Coach Trish Hannah. We are live today. Last week we had a pre-recorded show with Dr. Gregory Neal on the reconstructive and cosmetic surgery. We had a bunch of questions though. Persons were sending in their questions to me beforehand, and he was able to answer all of them thoroughly. Listen to me, Dr. Neal. Even after the show, that entire week, persons were coming up to me, and everything that was said about him were positive remarks, compliments, saying how gentle he is, how the bad manners, because you gotta have bad manners, and how thorough he is as a doctor. And I mean, I was proud. So I think we related. We don't know each other from a hell of beings, but the fact that I had him on the show, it was just wonderful. It was phenomenal. And thank you once again, Dr. Neal, for being a part of us. And I guess we don't have it yet, but by this week, we will have the pre-recorded show on our YouTube channel. All right. Now, I had the opportunity to, because this was my first time listening to the pre-recorded show last week, to sit down and truly listen. Because normally when I listen to my shows afterwards, it would be me trying to balance work and listen at the same time. But last week I was in my front room with my family, and we were just tuning in, and guess what? I was so proud. I was so proud. Tony laughing at me. I was proud because, listen, from just fumbling, I still fumble a little bit, but I was just in my element with Dr. Neal, and he made it possible. He was down to earth, and he gave us some insight and knowledge. I can't wait to share that recorded show with you all. Listen, the only thing that I regret though is because with pre-recorded shows, you're unable to do giveaways, right? And y'all know I like to do giveaways. I live on Blessing Boulevard. I am blessed, and because I'm blessed, I have no other choice but to bless other people. So we have to triple up, not even double up. We have to triple up today. I have to make sure my listeners are straight with their giveaways, and guess what? We have lots of really good giveaways today. I need you all to please share the link. Share it. Call your neighbor, call your friend, call your Grammy. That one. Call her and let her know that Your Lane Talk Show is on. Your Lane Talk Show was created to empower, educate, and encourage women of all ages. And today we're going to learn more about caring for our eyes, ears, and mouth. If you know anyone who have little challenges with their breath or their teeth, now I say challenges, now I ain't dissing nobody, okay? Challenges, or anyone who have to squint their eyes to read or look at anything, that's me, Anthony. Who may have a hearing problem, just ask them to tune in today. Listen, let me tell you something about my Grammy. God bless her. She's no longer with us, but she used to have CNN on the loudest. I don't even know what was. I could hear CNN from the road, okay? And it doesn't make sense. It didn't make sense knocking on her door. It didn't make sense ringing the doorbell. You had to go to her room and bam on her window in order for her to actually hear us. And It is what it is. So I can't wait to talk to my very first guest so she can tell me about these our hearing and what we can do about that. Your Lane, episode 18. Eyes, ears, and mouth hygiene is brought to you by Johnson and Johnson, distributed by Lowe's Wholesale, Airborne Freight and Cargo Services. John Shoe Store and Accessories, Family Medicine Center, Skin Solutions, Day Spa and Salon, Carrie's Fabric and Uniform Store, Palmdale Vision Center, My First Dentist Pediatric Dentistry, Premier Dental, and Bahama Herring Clinic. You can find all you need for skincare like Neutrogena, Aveeno, and Clean and Clear, allergy, cold, and sinus meds such as Tylenol and Benadryl. Listerine mouthwash leaves your breath so fresh and clean. And let's not forget about our little ones. Johnson's Baby, Aveeno Baby, and Desitin has taken care of the precious ones for generations. Why stop now? There's lots more brands for everyone. Johnson and Johnson, something for you, something for me, and the entire family. All products can be found in Lowe's pharmacies or your local retailer. My predictions for today, my emotions for this episode are 95% aha moments. We got doctors in the house. They come in to educate us. So aha is at 95%, 5% laughter, and I only scale in that because I'm not certain. I see Dr. Treasure looking. She looks dead serious. I don't know if we have a clown in the midst of us. I don't know if we have a comedian. I don't know. So I'd say 5% just in case, and 0% teardrops. I don't think anyone has a reason to cry today. You can view us on Facebook on Your Lane Life Coaching's page or Star 106 FM's Facebook page, or you can listen to us on channel 976 on cable. You can view the past shows on YouTube. Just look up Coach Trish Hanna. For there, you will find all of our rebroadcasts. I am inviting my audience to please like and subscribe. And for today, you have an opportunity to call in and ask any question that you may have to any of our doctors. The number to call is 328-8164. That's 328-8164. Share the link. Trust me when I say share the link. We want to be able to help some people today. I have with me, next to me, an audiologist. Her name is Dr. Treasure Kenny-McKinney, who completed her 4th year externship at Charlotte Eye, Ear, Nose, and Throat Associates in North Carolina and worked at a busy ENT practice, allergy ENT clinic of Northeast Texas.
Yes.
Yeah. Do you have any there? Make sure. Following graduation in 2019, she initiated an audiology clinic within a large private multi-specialty clinic, Family Medicine Center. Woohoo! Man, she already making history, Tony. Here in Nassau, you making an impact already. Most recently, listen to this, Tony, in 2021, she started her own practice. Okay? Boss lady. Bahama Herring Clinic, which focuses on diagnostic hearing tests for children and adults and treatment of hearing loss. Dr. Treasure Kenny is also an American board certified in audiology and holds a certificate in tinnitus management. Welcome, Dr. McKinney. Or what can I call you, Dr. Treasure?
Whatever you want to call me.
Whatever I want to call it, Tony. Welcome to Your Lane Talk Show. How are you today?
I am doing well. I just want to say thanks for having me, and I want to say good evening, Bahamas.
Good evening, and thank you. You're welcome. Now, fun fact, Doc, and let me know if this is correct. I got this from this audiologist, Dr. Laura L. Brady. She said, ears are completely individual, just like fingerprints. She said that Yahoo has explored technology that could unlock a cell phone when held to the ear. How true is that?
Oh, that's
I didn't know that.
So Yahoo can unlock
Cell phones just by putting, just like how we have fingerprints and we have our face recognition. You can put your ear to the cell phone and unlock the cell phone.
Yeah, I'd say that's pretty advanced because everybody's, the anatomy is different for everyone. So, and even when we think about technology, things are so advanced. So I would definitely say that that's very likely.
So, Dr. Treasure, what are some reasons why people? I had to use you first. I had to let you come on first because you hardly hear about doctors coming in, audiologists coming on air, talking about the air.
Yes, yes.
Ching. You'll catch that tomorrow. So let's talk. Why do people come to see you?
Okay. So people come to see me sometimes out of frustration or their family members pushing them to come and see me. But a lot of times it's due to communication barriers. So maybe that's causing frustration at home with a spouse, or maybe the family member is complaining, like you said, the TV is just extremely loud and that's causing frustration at home. Or they may just notice on the job or even socially that they're not hearing well. And sometimes you isolate yourself after a while when you start to realize that you have to put in so much effort to hear. So a lot of times I see people with hearing difficulties, and then sometimes ringing, or like you said, tinnitus is a big problem as well. So those are some of the popular reasons that people come in.
Let me ask you a question. Does talking loud, is it any indication that you have a hearing problem?
It could be. So I think some people just have that natural voice quality.
That's my husband.
Yes. But for a lot of other people, because they may have significant hearing loss. And so because they do not hear themselves at a normal level, they will naturally speak louder.
Dr. Treasure, I sent my husband to you.
Okay.
I sent him to you. This was last year, the latter part of last year, because he would just, listen, I could hear him. He would have an event in the back, and I'm in my room. Okay, I could hear him. I can't hear nobody else. We have, when they're watching their football, he's the loudest one.
Okay.
Right?
Okay.
I can hear him when he's outside talking or coming in the yard, coming with his cell phone. I can hear him, and I'm like, you need to go get your ass. I literally sent him to you at Family Medicine Center at that time.
Okay.
To get your ass.
Hopefully, I saw him.
Yeah, I guess and this is what you said. His ears are perfect. There's nothing wrong with his hearing.
Okay. Yes. So that's just natural for some people, and then you just have to pay attention to the other signs.
So
like
I asked him to get a second opinion because I ain't too sure about that. Go ahead.
No, I was just saying, that's just natural for some people, but otherwise you'd also have to look at what else is going on. And so if they're having other difficulties, then that could also be an indicator that, hey, they really need to get their hearing checked.
And so tell us then, why is caring for our ears so important?
I think it's important because, we socialize and interact with the world through our hearing as well. And our hearing is actually connected to our overall brain health. And this becomes even more important as we get older. When you tend to socially isolate yourself, that can lead to depression. And sometimes depression could be social isolation that could be a risk factor for dementia or cognitive decline. So getting your ears checked is just about maintaining a nice quality of life and being able to interact and socialize with people, on a regular basis. So that's really why it's so important. We hear with our ears, and, that gets translated to the brain. So it's also about that brain health, keeping that part of the brain stimulated as well. So I think that's why it's so important.
I think, okay, so let's do a giveaway then.
Let's do a
giveaway courtesy of Bahama Hearing Clinic.
Yes.
Very easy. The number to call is 328-8164. And the question is simple. Other than for hearing, what else can our ears, what's the way I want to put it? Why are ears so important? Other than for hearing, because there's another thing that of course,
Okay.
So other than for hearing, why is it that our ears are so important? 328-8164 and 328-8164. You're going to get a free hearing test courtesy of Bahama Hearing Clinic. All right. So let's move on, Doc. Why is wax so important? Let me interject. I came to you too,
Okay.
I was to you. I'm telling you why I came to you. I came to you because I had wax built up.
Yes.
And it was difficult for me to hear, other people out. Right? I was also frustrated because here I am with my clients and they are cracking jokes and I just laughing because I see them laughing, but I really ain't hear what they say.
Yes.
And then there's nothing worse than when you have your husband whispering sweet something in your ear.
Yes.
And you be like,
and
what you say?
Yes. It's very funny that you say that because that interaction in the clinic is very interesting. A lot of people are grossed out by wax, but I always tell them, the wax has protective properties, but sometimes it gets to be a lot and that causes blockage and sometimes pain. And then the worst enemy is Q-tips. So, a lot of people say, yes, I do use Q-tips on a regular basis, That's going to take some of the wax out, but it's also going to push that further in.
That's
And
how
I've
come I get to see you.
Yes,
Mhm.
yes. And so that has definitely caused a lot of problems.
Mhm.
So that'll just kind of impact the wax and it makes it that much more difficult to get out. And then it can cause a temporary hearing loss, like you noted as well.
And that's exactly what happened, Tony.
What do you
I
use?
think that's what I'm gonna ask for right now. But Tony, I think it's so satisfying when you put the Q-tip in your ear and then you maybe it's just me. Yeah, it is definite. Okay, I thought it was only me. So you put the Q-tip in the ear and you're just doing it around, whatever. And it was Dr. Kenny who told me, Dr. Treasure who told me, listen, you can't do that. You have to put, by doing that, it causes the wax to go deeper in the ear. So it was so bad for me that she had to do 2 rounds.
Mhm.
The first time she tried, but now she got these high-tech things. Now, back in the day, I could say his name because he retired, Dr. Ramsing, used to use the old-fashioned squeeze bottle to squeeze the thing out. Dr. Kenny have this high-tech thing. The only thing left for us to do is just stand right there and just let the thing do it ourselves. Okay, it was very, very advanced, very high-tech, and I love it. But what happened is it was so severe for me that she had to put me on, I think, 3 days treatment with wax softener, and then come back to her so that I can get everything out.
Right.
All right, and that's what happens to me when you stick things inside your ear. I have a coworker that uses her hairpin.
Be very careful. Yes.
All right. So what are your steps for conducting a hearing test? If someone wants to come to you and say, okay, I'm gonna get my ears tested, what is the procedure? What do you do?
So I do like a brief case history. So I kind of ask them what's going on. And then I kind of ask some medical related questions just to find out if, they've been exposed to noise, does hearing loss run in your family? Have you had a history of ear infection, sinus, that type of stuff? And then after that, I would run a test to check the middle ear function because sometimes that can affect the hearing in the ears as well. And then we go into a hearing assessment. So that's like the beep test. So whenever you hear a little sound or beep, I'm looking for the softest sound that you can hear over a range of pitches. So we do that. And then a lot of times if they're a hearing aid candidate, we do speech testing as well. So that's just turning the volume up, having them repeat speech, and then doing speech and noise testing to see how well they hear when there's background noise present. So all of those things are kind of involved in a basic hearing test.
I love how you said the speech test. My daughter was 3 at the time, and she was not speaking.
Okay.
And whatever words that she was trying to formulate, it did not sound like that particular word that she wanted to use. And so I kept going to our pediatrician, letting them know, hey, I have an issue with the fact that my child is not speaking. She's 3. And I got the brush off, hey, this is what happens. It's okay. It's normal. Kids, they really just take them and put them in school, put them in preschool, and they'll get to learn from their parents.
Right.
I did that, and still nothing. When I used to pick up my daughter, and I'm listening to everyone else around her classmates, just saying things bit by bit, but still saying things, and she was still not talking. So I tried to figure out what was happening, and so what happened is I went to another institution, and they said to me, "Oh well, in order for you to do this, you're gonna have to get some type of reference or referral from the pediatrician."
Right.
Now, that particular pediatrician was not there, but another pediatrician was, and I never had her before. I don't. That's why I can't call her name because I don't want to get, But she did something for me. She faxed over a referral for me.
Right.
You know what I mean? Just because she heard as a mother the concern that I had.
Yeah.
And would you believe that after my daughter had her testing, her hearing test, it was we found out that she had fluid in her ears.
Yeah.
And according to that doctor, when you have fluid in your ears, it's like you're underneath the water, so you're unable to hear exactly what's going on. I'm helping some mother out there who
Precisely.
may have, be wondering and worrying about their child. All right, so that's so important to just get. So let's talk about that.
Yes. Yes, that's very important. So that's why newborn hearing screenings are implemented. School screenings are implemented. Some parents question, well, why am I doing this again? Why am I bringing them for a hearing test? You can tell sometimes if there's a significant hearing loss, but even mild hearing loss may go undetected. And you may never know unless you do that screening or you do a hearing test. And younger kids they're more prone to developing fluid behind the eardrum. So you have the eustachian tube that connects the the back of the throat to the middle air space. And so that's more horizontal, so it's not fully developed. And so that causes them to be more prone to infections. So you always want to be screening them just in case there's fluid buildup that can sometimes affect the hearing,
Right.
which then can affect speech development.
Right.
And like you said, you know, even after you put her in school, she still didn't develop normally with speech. So early intervention is always key, because some parents will say that, you know, let's just wait it out and see what happens. But you cannot predict that, you know, your kid will just automatically pick up speech when they start interacting with kids. So you always want to, you know, you be more preventative and do what you need to do in the beginning.
Absolutely.
Mhm.
I had to take it to a speech therapist afterwards.
Exactly.
You
Yeah.
know? If I had known earlier, you know. So you said let's talk about tinnitus. What is it? What causes it, and how can it be cured?
Okay, so tinnitus or tinnitus, either way, comes from the Latin word tinere, which means to ring. So that's basically a sound that the person hears, but typically there's no external sound source. So I could have tinnitus, but obviously no one else will hear it. So there can be many different causes. So a lot of times it can be due to changes in your hearing, for instance, or it can be like an ear infection or something that causes a temporary hearing loss that can bring about tinnitus as well. Sometimes even noise exposure. You'll do a hearing test, that's normal, but the person still complains that they have ringing, and that loud noise exposure over time can cause ringing in the ears as well. And then you have other things like ototoxic medications, so meds that are just damaging to the ear that can cause that sensation as well. Or even if you have middle ear dysfunction, like sinus or allergies, especially sinus, that can sometimes cause weird sensations like that in your ear as well.
So what can be done to? Is there a cure for that? Is it something?
That's a great question. So if we determine that it's maybe medications, sometimes even certain over-the-counter medications can cause, if you take it in large amounts, that can cause it. So if you find out that it's that, you can kind of reduce it or alleviate it. But a lot of times there's no cure for tinnitus. So it's rather management. And management will typically be sound therapy. So that's sound enrichment. So you're just kind of distracting the brain from paying attention to the ringing or buzzing in your ears. And then if you have hearing loss, a lot of times hearing aids serve as a treatment for tinnitus, because your brain is now picking up on the sounds that it's been missing out on. So that perception for a lot of people is reduced. And also stress and sleep management. If those things get out of control, you can definitely notice it more.
Listen, I hope you're all listening. The stress causes so many issues.
Yes.
And it's ridiculous. Like, if you cannot control, this ain't my time to talk yet, but I just had to.
Oh, good. Yes.
If you cannot control what you're dealing with, leave it alone. Some things you just can't control. You just leave it to be it as it may. For those who believe in the Bible, you know, the Lord said he will take care of whatever it is that we're going through. For those who don't, just understand that time will take care of what you're going through. You can't do it. If you can't control it, leave it alone.
Yes. So all of those things, if you hear it briefly for a couple of seconds and it goes away, that's normal. A lot of us get that from time to time. But if this is something that continues to persist and you notice it rather frequently, those are some of the techniques that you can use.
So how do you know when, well, first of all, let me ask, are there different degrees of hearing loss?
Yes. So you could have normal hearing, and then it can range from mild all the way down to profound. So there's definitely different degrees, different configurations. So as we get older, a lot of times our hearing drops off in the high frequencies first. So a lot of people will say, I hear, but I don't always understand. Or if I go into a crowded situation, sometimes it becomes difficult to understand what's being said. And then when you get to severe or profound hearing loss, sometimes hearing aids may not be enough, and then a cochlear implant may be more appropriate.
Can you hear me? You hear what she's saying? Okay, let's talk about this. Tony had some headphones in his ear, but let's talk about those who like to use Bluetooth in their ears and constantly, you know, throughout the day. That's what they have. Even at school, some people use it. Does that have an impact or effect on our hearing?
It can. So if you're someone that's blasting music all the time, over time that can have an effect. So if you have it on and somebody else can hear it, a lot of times that's often too loud. But ways to know is that your ears may seem dull after listening to music, or you may have temporary ringing. And so that ringing is just a sign that you need to take a break. One rule is the 80-90 rule. So if you listen to music at 80% of the maximum volume, you can listen to that safely for about 90 minutes before it becomes unsafe. So you just want to keep those things in mind. And even wearing noise canceling headphones may be a little bit better, because where it isolates the noise, you may find that you don't need to turn the volume up as much.
That's wonderful.
Mhm.
What about the Bluetooth for the phone calls?
Yeah, so this is the same concept. You just want to monitor how loud that is as well. And so if that can be heard externally as well, then we know that that's just a little bit too loud, but they're usually safe. And even on your iPhones, it has, features for a safe volume as well. That'll let you know.
Okay.
Mhm.
So, Dr. Treasure, yes, someone says this information needs to be taught. Absolutely. Is there anything else that you would want to share with the listening audience? Some things that we need to know about our ear care?
So no Q-tips. So I'll just put that out there again. You can use Q-tips at the opening of your ear canals, but try not to push it in too deep. I know that's very satisfying for a lot of people. But early in my career, I've also noticed that a lot of us are hesitant to get our hearing loss treated. Obviously, money is a factor, but I don't think it's the sole factor for why people are so hesitant.
Yeah.
So I think there's still a stigma around hearing aids. But hearing aids, I brought a pair. Hearing aids are a lot smaller and less noticeable. So
can you get it on the screen there?
Right here?
Mhm.
Okay, so this is a behind the ear device, and this is the little speaker that will have a tip that goes in the ear. So it's very small, comes in a range of colors. But I think people are just afraid of what other people will think. And I guess it's a sign that, I'm getting older, things are going downhill. So I see a lot of hesitancy in getting your hearing needs addressed. So I do want to let people know that it doesn't hurt to just come in and have a conversation. And then you can ask all of the questions that you want in regards to your hearing as well.
Listen, and we're giving you free testing, free hearing tests with Dr. Treasure. And the numbers to call is 328-8164. You be the caller. You get an opportunity to have a free hearing test, courtesy of Bahama Hearing Clinic. All right. So, Dr. Treasure, thank you so much. And let us know where we can find you and the social media accounts that you have, etc.
Well, thanks for having me. So my practice is located in Harbor Bay Medical. So I have a space within there. But you can contact me at 804-3979. Otherwise, it's Bahama Hearing Clinic on Facebook and at Bahama Hearing on Instagram as well.
Absolutely. Okay, so we're going to take a break. Oh, we have a caller. This caller, you've been holding on to Jesus because I was just about to leave. Go on to that. Hello and welcome to Your Lane Talk Show.
Hi, this is Catherine.
Hi, Catherine.
How are you?
I'm good. Let me know now. You're calling to ask a question, or are you calling to get your free hearing test?
I'm calling to get the answer.
Oh,
Okay.
Let's go. Let's get the answer.
Balance.
Yes. And so they're both connected in the inner ear, so that's great.
So let's repeat what we said. In order for with our ears, they're important for two things: one for hearing, and the other one for
balance. Yeah.
Thank you. Go ahead.
Oh, you just have the semicircular canals attached to the organ of hearing. So all those things play into each other.
And listen, you have a smart doctor who will make sure that you get the thorough hearing test, everything that you need to ensure that your hearing is on point. And if it's not even for you, if you want to bring your daughter in or your son in or whatever, your niece and nephew to come in, go right ahead.
Yes.
And your husband. Me, I didn't send my husband. So if you need to send your husband, send your husband. All right. But thank you so much, Catherine. Please leave your name and contact with Tony, our producer, so that we can tell you how you can collect your prize. All right. And congratulations, by the way. Thank you. So we're going to take a break. And on after this break, we're going to have optometrist Dr. Ebbie Jackson coming in to talk to us about our eyesight and the importance of our vision and eyes and sight. All right. So stay tuned.
4, 5, 7.
Hello to my Facebook audience. Thank you so much for tuning in. I hope everyone's doing well. We're going to transition. We're moving Dr. Treasure in the back, and then we're going to bring Dr. Abby in, and then at the end, we're going to have everyone back on.
Okay.
Yeah, good.
That's Catherine in the marriage. She said you probably didn't realize that, but y'all go to the same church.
Oh, okay. What is that?
Catherine in the marriage.
But I'm going to give you that information.
Okay, all right. Sounds
Just
good.
the only thing you have to do is just, if possible, take a picture with her.
Okay.
Right. So we can post it.
Okay.
Thank you. Thank you so much, Catherine, for calling in. I don't know if she's listening on here or on the thing. Thank you so much.
Classmate.
Your classmate? Wow. Dr. Ebbie, is anyone you don't know or who don't know you? From the time I put this flyer out, I've been getting so many persons calling, oh, I know Dr. Ebbie. Awesome.
Well, I've been practicing 31 years, so
Oh, yeah, they got to know us.
it's been a while.
Awesome. I'm excited.
This mic here? Okay.
I was teasing about hearing. I like this commercial.
Ooh, these nice, eh? But you in Nassau, how she get these? Well, Airborne Freight and Cargo Services is shipped to Opco now. All you gotta do is put it in here, and then brackets put Opco and put in Airborne Freight address.
Something we want to talk about is keratoconus.
Oh, go right ahead, Mom. I'm going to give you an opportunity to say, ask if there's anything else that you want to discuss. I want you to go right ahead because I am learning and they're learning.
Yes, you're different, Bianca. Talks highly about you.
Oh, she said famous lady, LOL. You just said something just now. Bianca, they talking about you, Charles. They talking about you. So we're only on a break to my Facebook audience. And listen, y'all have an opportunity to get prizes as well. You have an opportunity to get prizes as well. So just tune in so we can tell you how you can do that. Are y'all sharing? Could y'all please share the page? Please share the link. Put it on your page. Let's share the knowledge that we have. And we have a wealth of knowledge between these three beautiful doctors.
Yes, eyes, ears, and mouth connected.
Hello and welcome back. Oh, it was so awesome speaking with Dr. Treasure Kenny-McKinney just before our break. And guess who we have on now? We have next an optometrist, and her name is Dr. Abby Jackson. She famous, y'all. She famous. And Dr. Jackson is a graduate of Northeastern State University College of Optometry in Tallulah. Did I say that right?
Tahlequah.
Tahlequah. I have an L here. Okay, Oklahoma, Tony. I come to the right person. She has been practicing for the past 30 years in Miami, Florida, and Nassau, Bahamas. She has operated Palmdale Vision Center for the past 28 years and worked in public health for 12 years as a pediatric optometrist. She is a member of the American Academy of Optometry and a past president of the Optometric Association of the Bahamas. So we welcome you, Dr. Abby. How are you?
I am doing wonderful.
So
Ish,
happy
and
to
thanks
see
for
you.
having me this evening, and good evening,
Absolutely.
Bahamas.
Good evening, everyone. Let's see. Let's do a fun fact. It is impossible to sneeze with your eyes open. Is that true?
No,
That's not
that's
true.
not true.
That's what the people tell me on the
No.
office. No,
You can-
actually
You can sneeze
with
with your eyes open because it's such a quick blink as such, Your eyes aren't really closed, just a quick blink.
Yeah.
Yeah.
See, I can't be reading these people. Let's see why I have someone like you on the show. Because that's what they said. They said it's impossible. I see my camera flicking a little bit. It's impossible to sneeze with your eyes open. But my doctor, Abby Jackson, said that is not True.
It's a quick blink.
It's just a
So
quick
yeah,
thing.
so your eyes aren't really closed
They're not
per
closed
se.
per se. I
Yeah.
get it. I get it. Let's do a giveaway real quick. Give them some chance. Give them a chance to call in. And I think we're gonna say this is simple. What has an eye but cannot see? What has an eye but cannot see? The number to call is 328-8164. So I'm gonna give you all a chance to think about that and do whatever other. Don't trust Google because Google then give me the wrong answer and the information about it is impossible to sneeze, and my doctor said it's not. So, Dr. Ebbie, let's talk. What do you find to be the most common complaint that women have when they see you?
Women or persons in general? Because when we look at the population, for women, I suppose the biggest complaint would be DED, dry eye disease or ocular surface disease. That's a major female challenge, and even keratoconus to a point, but we'll talk about that one later. But dry eye disease is the major problem that affects females more than males.
Wow, we have a
We
caller
have a caller.
already? Wow, y'all just on it. Hello, caller. Welcome to your Lane Talk Show.
Hi, I'm calling to answer the question. What has an eye but cannot see?
What has an eye but cannot see?
A needle?
A needle. Who am I speaking to?
This is Miss Porter.
Miss Porter, welcome and congratulations. And so what's going to happen, you're going to get a free eye testing from Dr. Ebbie Jackson, courtesy of Palmdale Vision. So what I'm going to do is ask our producer to get your name and contact so that we can reach out to you to let you know how you can obtain it, okay? Thank you so much and congratulations. Go ahead.
Yeah, dry eye disease. For most women, as we age, and especially as you go into menopause, the tear glands start to dry up. As with other parts of the body, mucus production decreases, and so it affects the eyes tremendously. And there is really no cure for it, and it gets progressively worse as we age. Now, because of environment, because of technology, we're seeing more and more of it in the general population.
Okay, so, and then, I mean, because I'm using women, I know that men are listening as well, but I just wanted to stick primarily with women. So if you can ask, what does 2020 vision mean, and how can we tell if we need assistance with our sight?
That's a very good question. 2020 vision means that at a distance of 20 feet, you should be able to see a size object, and we normally use letters or numbers that subtends a degree of an arc of 20 degrees. The size of it, you should be able to see it at a distance of 20 feet. And that's what the normal standard is. However, I tell persons that that's the normal standard because if we have to go to court and we're asked to say, well, what is the person's vision? Then that is what we use to enable the judge or whomever to know, well, this is what the person is seeing for their visual acuity. However, many persons have 20/20 vision and still have vision problems. So I want people to recognize that. Yes.
So what do you tend to see as the other visual problems with the 20/20 vision?
Okay. Four main categories can occur that can affect person's vision. They can have a medical problem. And if it's a medical problem, it can affect your vision. But the main vision problems include farsightedness, which is hyperopia, nearsightedness, which is myopia, astigmatism, which affects both far and near, and then a condition which is medical called keratoconus. And those conditions would affect a person being able to see depending on what they're doing.
You use keratoconus twice. I have to ask you. Let's talk about keratoconus. Tell us, educate us.
Keratoconus is a medical condition that affects the cornea of the eye. The cornea of the eye is the front surface of the eye where light enters. Now, the cornea should maintain a shape like a tennis ball. However, persons with keratoconus or even astigmatism, what happens is that the cornea starts to become irregular. It starts to extend and take on the shape of a football or a different shape. And so that affects light entering the eye. The image coming into the brain is basically out of focus.
Mhm.
Now, someone who has keratoconus, kerato means cornea, conus means cone.
Mhm.
What happens is that the corneal cells start to thin and degenerate over time.
Mhm.
And what happens is it takes on the shape of a cone. So you find most of these persons cannot wear glasses after a while. They have to wear specialty contacts in order to be able to see. And what I'm finding now is that it's quite prevalent in our population. However, before 2020, when most people weren't as digital as we are now,
Mhm.
a lot of people got away with it, you know. And these persons, they tend to complain that sometimes they'll get a pair of glasses and then they could see sometimes with glasses, sometimes they cannot see.
Mhm.
They tend to
sound
rub
like
their
mommy.
eyes
Uh-huh.
constantly and they get a lot of itching, irritation, that sort of thing, but they cannot explain it.
Mhm.
And so if they come in for an eye exam and you check them and they're really not seeing well and you're like, well, how long this has been happening? Well, this has been happening a while, but sometimes I see, sometimes I don't see. Now that they have to use a digital platform, they're not able to get away with it like before.
Right.
And it's very prevalent in young girls, especially when they're going through puberty. If they have excess weight, we're finding that it's attributed. And then it's also our genetic component.
Mm. Ooh. Speaking of my mom, I see she's on the Facebook link. Happy birthday to my one and only mother, Joan Anderson. God bless you. I pray that you see many, many more. Listen, I need to send her to you. That will be her birthday gift. I promise. That's your birthday gift, honey. All right. What are some ways that we can protect our eyes naturally?
One, don't be staring out in the sun. We live in a sunny climate. We live close to the tropics. And so we expose to sunlight quite a bit. I say to persons in this day and age, you really shouldn't be outdoor without proper UV protection on, whether it's shades or your glasses. Even for children now, you know, the sun is much closer to the earth and it's causing us to develop growths on the side, fleshy growths that people sometimes think are cataracts, but they're really, we call them pinguicula. And when they start to grow on the cornea, then they're called pterygiums. And those pterygiums, if they continue to grow, they can affect your vision, distort your vision. So the sun damages our eyes and it gives us cataracts much earlier than normal. And we find people having to have cataract surgeries in the 40s, 50s, 60s, whereas persons who live in the north, they tend to have cataract surgeries later on in the 70s, 80s, 90s. So one of the big things when you're outdoor, you really should be protecting your eyes from the sun. Now, if we want to talk about the digital world, that's
Let me go
another
there.
thing.
I'm about to ask you
Yeah.
right now. So what should be, let's say in the nights, and I tend to do this a lot. I read on my Kindle a lot in the nighttime, but I usually put in the little there's something called, see I have it right here. Like the blue light filter or something like that I use. So tell us how should we conduct ourselves when reading in the night or using our tablets and phones in the nighttime? And in the day, of course, but let's start with the night.
Men love darkness rather than light. Because, you know. I say to persons, if you're using any sort of apparatus or anything at nighttime, you should have some overhead lighting on. We should not work in the dark. There should be some overhead lighting somewhere because it puts a strain on your pupil, and then you're even that affects the cornea.
Even with the setting?
Even with the setting, you should have some sort of background lighting on. Many times I go places when I say to persons, listen, don't watch TV in the dark or don't be on your computer in the dark. Turn on some overhead light to have some sort of background lighting.
For a second. Don't watch TV in the dark? For sure?
No, you shouldn't. It affects you over time. Yeah.
I was today old when I Tony, did you know that? Did you know, Tony?
I don't usually watch TV.
What? No, I'm sorry. The light, what you want the TV on for? You want to be able to see everything on the screen.
Well, if it's in the bedroom, it's in the dark.
Well, if you're going to the movies, that's different because it's, but you shouldn't make that a constant practice of watching television or being on your computer in the dark.
Right.
Because your pupil then has to work a bit harder in order to keep things in focus. So I advise persons not to have some sort of overhead lighting on.
Right. Okay.
Now, when it comes to the digital apparatus, we're going to talk about blue light first
Yes.
because blue light is so popular now. Blue light is a very good filter that was made to block the sun from entering the eyes.
Right.
Now, remember when you think of the rainbow, in school I had to learn it this way to be able to for tests. Richard of York gained battle in vain: red, orange, yellow, blue, green, violet. Now the blues, that's the most dangerous to the eyes. That's what speed up cataracts. So they came up with a blue filter. Before the blue light, though, what was it? You place those screens, the monitors on your
Right.
screens,
Right.
okay?
Yes.
That was supposed to be able to protect our eyes and,
Right.
not cause us to have vision problems. So now it's blue light. Blue light was made for the sun. It blocks the radiation, those rays from the sun.
Mm-hmm.
So, of course, man capitalized on that and say, oh, that's needed for your computer or your digital apparatus because UV is coming off of that and it's affecting our vision. That amount of ultraviolet that's coming off our digital apparatus is so minuscule that it cannot affect our vision like that. So I tell persons, you can blue light it, you can red light it, you can pink light it, you can do whatever kind of light you like with it. If you do not treat the underlying vision problem, there is still a problem.
Right.
Now, some people swear by blue light, but if you're having to use blue light, then you need to have your eyes checked because chances are you have an underlying vision problem. So deal with the vision problem, and then if you want to put blue light on your glasses, which I do recommend, go ahead and do it.
Oh, so you do recommend it?
I recommend it.
I noticed that they have this new thing now with the children where they allowing them to wear the glasses in the front of the.
Yeah, but if these children have not had a vision exam, how do you know if that's what they need or what their problem is? You have people who are diagnosing, So, and then a lot of these blue light filters, you don't know where they're made. If it's really the amount that is needed, most of it is coming out of China where it's cost you a couple cents and dollars. And so everyone's buying them and using them and saying, oh, this is helping. But don't run from the fact that you really need to have your vision tested and know what's your condition or diagnosis and move on from there.
So, okay, I have a friend, you know her very well, that complained about headaches. She came to see you. She was complaining about headaches and come to find out that she needed some work done. And what exactly did you do? And how can we know or tell just because a headache? Because headaches can be done for numerous of things. People have reasons for headaches, but how do we know that we need to see you if we have constant headaches?
After the lockdown, when we reopened in June into July, patients that I would have seen in January were now back in my office saying, Doc, I'm having headaches. I'm having headaches. Why? Because during the lockdown, what were we doing? Tablets and phones the entire time. So that distance, that working distance, over time caused, and the biggest problem that we see that really causes the astigmatism, the headaches, is astigmatism. Once that cornea starts to rotate and change, because we're working closely, the cornea is having to keep things in focus with the muscles, and the cornea starts to rotate. And once it rotates and it moves off axis or changes its curve, you find a lot of people tend to have headaches. And the slightest change in that curve could cause a headache in a lot of persons. I'd say to persons, and I think primary care doctors need to recognize this, because I have seen situations where patients have gone, had MRI done, had this done, had that done, the next. And then the doctor said, go have your eyes checked. And only to find out they only needed glasses.
Oh,
I know of 2 situations where one person went into anaphylactic shock because they were having a test done. They injected them with a dye, went into anaphylactic shock, almost died. Still didn't find anything wrong, only to find out that person needed glasses. Now, there are several types of headaches, mind you. You can have headaches from aneurysm, and you got to be able to distinguish them.
Right. But
the basic constant headache, I say, have them have their eyes checked. Rule out vision first, and if it's not vision, then you need to proceed further.
So, and I have a coworker that when we're having meetings, her eyes are very, very runny. She just WhatsApped me just now, so she's tuning in via radio. So what do you think that would be
There could be several things going on. Okay, it can be dry eye, which is a very common problem now, ocular surface disease, because we're staring all the time. We're in air-conditioned fans environment, and so the surface is drying out. We're not blinking sufficiently, and therefore we're developing ocular surface disease. So it could be that. It could be an underlying vision problem also.
Wow. All right. So what else, or what is it that you want to tell us, those who are listening, anything that we didn't discuss that you may want to share?
There are so many diseases and things related to the eye. People have hypertension, diabetes. You know, in the last 2 weeks, I have sent about 6 patients because their pressure was over vision problems, glaucoma. I mean, there's so many things that can affect the eyes that are prevalent in our population that persons need to begin to pay. Wireless change, we spend more time on digital apparatus, so therefore we cannot neglect our eyes. We must have our eyes checked. Children, they're spending time playing games and
Yes.
texting and doing more things. So you can't go and just have a vision screening done with your child and think that's an eye exam.
Right.
You know what your child visual status is, know what your visual status is, and from that you will be able to know how to proceed. And so I tell people we need to do better in our population. We need to have our eyes checked. You can't neglect the eyes now, because the one thing you don't want to lose is vision.
No.
You can lose your hearing, you could your teeth, your mouth, everything else. But when it comes to vision, once the curtain comes down, the world will change for you.
Doc say you can lose your hair and you can lose
Yes,
your teeth.
you can lose
but for
everything
goodness
else.
sake, don't lose
But
your vision.
if you came in the world seeing, to lose your vision, life changes totally, because you're dependent on someone for the rest of your life.
Absolutely. So before we take a break, just give me your steps when you go and you say, okay, let me give you a vision test or eye test. What are the steps that you take?
For one, it all depends. When children come in, I pay attention to the way they behave. The
Right.
minute they come in my office, I'm watching them, observing them, because, you know, children come with different problems. And autism is another big problem in
Right.
our society that you're finding children having problems with. And you have to counsel parents on, listen, this is what you need to be doing.
Mhm.
So I pay attention to the child. I do my assessment. Then I ask the parent, tell me about your child. What are you noticing? What are you seeing? How are they doing in school? Do they seem focused to you? And I could tell if a child is focused or not, because I'm watching them the moment they come into
Right.
me, you see.
Right.
Now with adults, there's so many different things. It can be glaucoma, it could be cataracts, it could be an underlying vision problem, it could be hypertension, it could be diabetes, and the list goes on and on. But the bottom line is, let's begin to take care of our health
Right.
as a people. You know, we need to eat properly, we need to exercise, we need to have our eyes, our ears, our mouth, and our full body checked on a regular basis, because there's only one body we have. And I say to persons all the time, this is a constant conversation I have. Why are you working if you're not taking care of yourself?
Okay.
What is the point?
What is the point? What is the point?
So take care of your own body from the crown of your head to the sole of your feet, and then you're able to take care of others.
Absolutely. I love it. I love it. Yeah, well, that's Dr. Ebbie Jackson, y'all. She just gave us all the information. I learned some things. I hope you all were able to learn as well. Nobody wants to get to the point where you lose your vision. That's because of situations where you can't control your diet. You know what I mean? And because of that, you get diabetes and all these other diseases, and of course your eyes, your vision, for you to be impaired, right?
Yes.
Visually impaired.
Yes.
And so, Doc, thank you so much. Don't go now, because we're going to bring you back in. So I don't know. Let us know how we can reach out to you.
I'm located at Palmdale Vision Center, and we're East Avenue South. That's between Centerville Food Store and Battery and Tire. And our numbers are 325-3585 or 325-3937. And then you can also find us on Bahamas Local or Facebook, online, however.
Excellent. I have a question on here, though, that asks, how can you prevent having glaucoma? You can answer that real quick.
There is no cure for glaucoma. No, it's managed and treated, but there is no cure for glaucoma. So if
Is
you
it
have,
hereditary, or is something
it's hereditary in most cases, and it's very common in the Black population, Black Hispanics, that population, and it's prevalent in our country. So,
real
yeah.
quick too, what are some foods that we can eat to help strengthen our eyesight?
Well, I get that question all the time. And they say, Doc, what about the carrots? I told them I would be selling carrots. I would not be in that office working as hard as I do if carrots really help. But I mean, with the body in general, we need water. No, no, the back of the eye, there's some cells called carotene, right. And so people heard that and they think, oh, carrots. So eat carrots, eyes get better. Man, listen, if that was true, I'd be
Doc,
selling carrots.
I just hope my children ain't listening to the show because that's what I use in order for them to eat their carrots. So let me we'll edit this one when I say it again in my house.
But everything is in proportion. But no, as with the entire body, we need to eat right for cells to really generate and work efficiently. And it's the same with the eye. So, but there's no specific food or something that you can say, take this and this is going to do the.
So, that's my final question because these questions just popping in. How can you tell if your child needs glasses?
Well, you can pay attention if they're moving close to objects, holding objects closer. And then in school, pay attention to their schoolwork. Well, I don't know. We're going back to school now, face to face. So writing, pay attention to how they're writing. If they're staying online, if they're writing bigger than normal, making silly errors and mistakes. That is very common. I mean, you see it all the time because if they have an underlying problem, they can spell, but when they have to write it down, you find they make silly errors and mistakes.
Wow. Okay, we're going to talk more about that later, but let's take a break. Thank you, Ebbie. Don't go too far, Dr. Jackson. Don't go too far. Right after our break, I say breakfast, we're going to have pediatric dentist, Dr. Kristen Darville. Stay tuned.
Mm-hmm.
Thank you to my Facebook audience again. We're transitioning. We're going to let Dr. Ebbie go in back, and Dr. Kristen is going to come in so that we can hear about, I say in breakfast, I'm so hungry. We're going to... yeah.
I'm trying to figure out what's going on with your camera.
I don't know what's going on with the camera, Tony.
The pressure is on.
What?
No. Also find school bags, school supplies.
Listen, what's the trivia question? Let me make sure I know that.
Well, let me do what I have for you.
Oh, Jesus. That is so funny.
Oh, you probably know this one. I don't have to say it because the audience can still hear you. But this one is very easy.
Oh, the audience.
Yes.
Okay.
I learned this in biology. You got this. Simple. No, but sure, it's simple. Watch out.
It's okay. It's okay. It's okay.
You got this.
After school time is here, and so are the sports styles at great prices and charms. Great prices on brands like Clarks, Sperry, Timberland, Guy Farm, and others you've grown to trust over the years. Both you and your child.
It cost me a minute, right? With each one. This one is for the audiologist, and this one is for the optometrist. Write that down so I can distinguish before I end up calling one for the wrong thing. Please. Tony, what's going on with this cameraman?
Nikki, what that is you buying from Victoria's Secret? Now they sending over some clean sign in the building articles so she would wait for Uncle Thomas' 90th birthday. Ooh, these nice things. How she get these?
Well, I suggest that you order another camera and send it over with airborne freight and cargo services in time for the next show next week, please. Thank you.
We got a lot of cameras in here. Just that these things is like a baby.
Yeah, I don't know why. No, Uncle Thomas can't see. Uncle Thomas needs to go to Dr. Ebbie.
Hearing loss alters the way we appreciate everyday sounds. It changes the way we experience day-to-day life. At Family Medicine Center, we'll help you achieve the highest quality of hearing possible. We diagnose and treat hearing conditions for patients of all ages. If you or someone you know is suffering from hearing loss,
She just came from there, so she's no longer there.
Oh.
Dr. Kenny, but that's where she was, and then she opened up a notice. That's fine. I wouldn't have done that if
You know, we can
I know.
We get in trouble for advertising.
Yes, we know that. We know.
That's why we have no ads with y'all.
I know.
I'm back. Ready?
Welcome back, everyone. So, guess who we have in the studio now? Dun, 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 dun. Dr. Kristen Darville. Oh my gosh! And before I actually do our trivia, because we're all excited about this trivia, y'all like to win things. Nah, I love it. I love it. Let me tell you a little bit about Dr. Darville. Now, after having a rocky start with her first dentist, Dr. Darville eventually ended up with a dental visit that left a lasting positive impression on her. I can't wait to hear what this is. This experience was her motivation to pursue a career in pediatric dentistry. After completing her dental degree at Meharry Medical College, Dr. Darville went on to complete her pediatric dentistry residency and hospital-based program at Metro Health Medical Center in Cleveland, Ohio. Dr. Darville enjoyed teaching, so she decided to remain on staff as an attending dentist, teaching residents and providing patient care. In 2012, she returned to her alma mater as the chairman and associate professor in the Department of Pediatric Dentistry. Realizing the importance of giving back to her country, she moved back to the Bahamas. She moved back in Nassau in 2013, and in 2017, she opened her practice, My First Dentist. Whoop, whoop. Her most recent accomplishment was the opening of Premier Dental Group with Dr. Barry Russell. Tell him hello for me. A multi-specialty group catering to the entire family. We got all kind of bosses in here, Tony. Oh my gosh, they are doing big things. Before we get Dr. Darville to speak, I want to give away free teeth cleaning for your child, courtesy of My First Dentist. And the question that I'm going to ask, as I told Dr. Kristen, is very simple. How many full set of primary teeth do children have by the age of 3?
Awesome. No. I wasn't going to answer. I ain't giving the question. I'm not going to answer.
So if you know the answer to that question, I'm going to ask it again. Listen now. How many full set of primary teeth do children have by the age of 3? If you can call in 328-8164, 328-8164, you're going to have a free teeth cleaning done courtesy of My First Dentist. I'm excited about it. And make sure you turn. But anyway, to be honest with you, I can't say that. I have 3 kids. One who is now at the age, and I guess she'll tell me if this age is appropriate to go to get her teeth cleaned. But my children actually go to My First Dentist. And my daughter had a fit getting her teeth cleaned. And the doctors there and the caregivers there were so patient with her. So patient. Very, very patient. I must say, honestly. So I've had first-hand experience with the nurture and the care that My First Dentist have. And this is not an advertisement of any kind. This is just
thank you.
My professional and my specific experience. I don't say professional, but my experience with My First Dentist. They're very, very nurturing to you. So you have a child. Do you actually deal with persons with autism as well? Kids
Absolutely.
Look at that.
Yeah. So pediatric dentistry, the training also involves special needs, and that can range from patients on the spectrum as well as children with medical compromising situations, as well as syndromes, because we do have some kids that have like syndromes here in the Bahamas that are very complex. So the training in the hospital, those extra 2 years, that's what that helped you to basically get through.
Awesome. So, Tony, here we have Dr. Kristen talking, and we've been in welcome her on the show. Welcome, Dr. Kristen Darville. How are you?
I'm great. Thanks for having me.
I love the energy. You are so welcome. So, this is a fun fact, but see how I get blast from Dr. Ebbie the last time. I don't know if it's true, so I'm going to ask you. But this particular fun fact, I Googled this. So let's see how true this is. I mean,
You didn't go to Wikipedia?
No.
Okay.
I went to Google. So the fun fact is, and you'll correct me, teeth are the only part of the human body that can't repair itself.
This is true.
Oh, look at that!
This is true. Despite a lot of myths on the internet.
Mhm.
There really is nothing you can do once your tooth breaks down other than go to a dentist and have it repaired. And then, of course, they do have like remineralizing agents out there now that they're trying to focus on, fluoride being one of them, that kind of helps with remineralizing. But a lot of times, by the time a person realizes that they have like a cavity or have pain, there's nothing that you can do to kind of repair it. Like your body doesn't repair it.
Now, this is the nosy part of me, right? You, in your intro or your bio, you said that you had a rocky start with your first dentist, right? Are you able to share a little bit of that? rocky
Yeah, I
start?
love sharing.
Okay, go ahead.
Love. So the first time I went to the dentist, I remember I had to get a filling, and I remember she did not numb it because she probably thought, "Oh, that's just like a little small filling. Let me use the drill." And at the time, this was like you didn't have like all this fun stuff that we have. No TV, no nothing. My mother didn't come in the back or anything like that. She was like, "Go ahead, you big girl." And I was like a very good cooperative child, but I remember cringing to myself. So I didn't cry, kick, scream, nothing. But I was like, no, we're not going back for that little electrical buzzy drill thing. We're just never going back for that. And then I remember I had a toothache and I was just like so nervous. This was like years later. And another thing is, my parents did not believe in regular checkups. So when I told my mom I wanted to be a dentist, she was like, "For what? Like, why? Why do you want to do that? Like, nobody likes the dentist." Anyway, long story short, went to this other dentist, had to get her tooth pulled. She had like these bubblegum topical gel, and it was like, she was like calm, and then she had some like gloves that had a scent. And I just realized that your experience dictates like how you feel, your perception. Absolutely. And like Dr. Ebbie was talking about, like Bahamians, we avoid medical checkups and dental checkups and all of these health related things because our experiences tend to have been bad. And the more you neglect your health, the worse it is. So that's how come when you do go, the news tends to be bad or the experience tends to be bad because you waited till the worst case scenario. Yeah.
That's like me way going. But honestly, when I the first time that I went into my first dentist, once again, shameless plug, too bad. This is my experience. The first thing that my kids ran to is this board that you have on there.
Yes.
They were playing with that. And then when I went to register them, there's the receptionist that gave them these coins, and then the coins they go. So they were already excited because they were nervous going to the dentist. This is their first time, so they didn't know what to expect. So they get this coin, and in the coin you put it in the little machine, and then you get your little stamp and toys, whatever it is. So from the get-go, from the initiation or the introduction of being a part of this dental place, they were amazed and they were amused. And then going into the back when it was their turn, I told you my daughter I have my hair like this. She's much better because she's been there since. But her very first time, of course, was just, but the nurses were very caring once again. And then you have like this TV, because the regular dentist play, they have the TV now, Tony. You just lay down and you just watch a little TV and you get a chance to, do whatever. So, and the fact that her brother was just next to her the entire time. I had the opportunity to be in the back also, just to calm her nerves and stuff. And it was just phenomenal. She was also given the opportunity to choose what type of flavor of toothpaste that she wanted. Okay. And that's how you get kids to want to really appreciate going to the dentist, right?
Yes.
So you did a lot, I don't know, whatever research you did, or, just you place yourself in the mind of a kid, because of course you've had that experience. And I assume that that's how you got around.
Yeah. And then what people don't realize, and this is kind of like going into what Premier Dental Group is about, is that there are general dentists, which you go to school for the 4 years to become a dentist during college. And then after dental school, you specialize. So it's if you would like to. So general dentists, which we have quite a few on the island, they are like jack of all trades, for the best way to put it, right? And then you have those of us who decided, well, I don't want to do everything. There's something I want to harp in on. Right. And we have pediatric dentists, orthodontists who do braces, endodontists that do root canal specifically. And so, and there's others. And so what that means is if you go to general dentist and there's like a specific problem, what that general dentist would then do is refer you on to a specialist who has done additional training to kind of know how to do that. So in terms of you saying the ambiance, and was that a part of my personal experience or was that a part of my training? Both. So basically from that, I decided I wanted to specialize in pediatric dentistry. And those extra 2 years after dental school is what allows me to know how to deal with children, how to deal with patients with special needs, specifically pediatric dentists. The goal is behavior management. So our whole focus is making sure your child has a good experience, whatever we do, whether it's talking, ambiance, laughing gas, sedation. The whole point is you went to the dentist, you weren't screaming and hollering. That lasts with you until you're like an adult. And now you just absolutely don't want to go to the dentist.
You have some adults who are still afraid to this day.
Oh, absolutely.
Yes.
And when you ask them, it's because they remember when they were however years old and they were held down and it was horrible.
So what is it, even though you're a pediatric dentist, all the questions that I have for you, of course, you were able to answer. And one of the questions I want to know is, what are some steps to having good oral hygiene?
I would say one thing that we take for granted is diet. People don't realize how what you eat really affects your oral health. People call in, they want to know why their breath has an odor. It's what they're ingesting, you know? People don't want to drink a lot of water. People don't want to eat hard, crunchy stuff that's better for your teeth than, for example, soft, sticky stuff. Parents, especially going back to school, they want to take the easy route. So chips, cookies, fruit snacks, all of this stuff sticky on your teeth, preservatives, causes a lot of sugar production. I mean, not sugar production, but acid production. So diet, number one. Habits, people are not consistent in terms of like morning and nighttime brushing and flossing. People just don't. A lot of people want to brush their teeth in the morning, which is great. So your breath is fresh for the person you talk to. But, you know, at the end of the day, you ate all this crap and then you just leave it in your mouth and you close your mouth and you go to sleep. And then you wonder why you have morning breath. That's why. That is why.
That's why, Tony.
So diet, hygiene, and then again, you still have to go to a professional. Right. So you need to go to a professional so that way you weren't cleaning your teeth the best or you weren't cleaning your child's teeth the best. Sometimes children be like, no, I don't want to do it. Forget it. Forget how to do it. All summer they wasn't brushing their teeth, you know, that kind of thing. And so you do have to just do your regular checkups because there are things that you think are not going on that are going on.
So, you know, back to this breath thing, this halitosis thing, right? Now, let's be real. Come on, thank God for masks for some people because my God, I mean, seriously. But let's, you know,
I agree.
So let me ask you, how should your breath, or how should a person's breath smell?
I think the best way for me to answer that is kind of neutral. Like you shouldn't have like a distinct odor that's obvious coming from your mouth when you're speaking to somebody. Obviously, if you just recently ate something or whatever, that's different. But if on a regular, you know, you kind of smelling your breath, or, you know, even when you smell your toothbrush when you finish brushing your teeth, you know, you spit in the sink, you know, there's like, you can tell there's blood in the sink. That's a big contributor. You know, that lets you know that you're probably going to have halitosis because you have gingivitis, because you have blood coming in the sink when you finish brushing. But basically, to answer your question in simple form, you shouldn't have a distinct odor coming from your mouth.
What if they have like a dry mouth?
So there's solutions for all of that. Dry mouth, you definitely have to keep your mouth moisturized. You have to do things that stimulates salivary flow. So you got to chew sugar-free gum. You got to have some type of sugar-free lozenge or something in your mouth. One thing that people take for granted is like sinus infections or postnasal drip. So if you have a lot of allergies, you got to make sure that you're like controlling just that drip in the back of your throat when you're having like, you know, snorting or whatever. That's going to contribute to bad breath. And then basically like your hygiene. So overall, like you should just really just not have you know, a distinct odor. And sometimes you can taste when your mouth tastes like a little sticky, your saliva is stickier than normal. That's going to contribute.
Let's talk about gingivitis. Is that something that can be prevented?
Absolutely. So gingivitis is one form of gum disease that is reversible. Now, when you get to the part where you're starting to have bone loss, that's going into what we call periodontal disease. But gingivitis is just the inflammation of the gum tissue, and it's going to cause bleeding. Why do your gums get inflamed? Because you have plaque buildup and your body is like, oh, look at this foreign substance on my teeth. Let me attack it. Your body responds by inflammation and bleeding. Like it's just like if you were to get a scrape or a cut, your the way your body immune response happens, regardless of if it's on your skin or in your mouth, it starts with inflammation, redness, bleeding. Those are like the main signs of your immune response. So gingivitis, again, once you get rid of the plaque, you get a good deep cleaning, you consistently keeping your mouth clean, you'll see it reverse itself.
So that will be the reason why there's blood when brushing, because somebody wants to know what causes the blood when brushing.
Absolutely. So I always tell the kiddies and the parents, when you see your gums bleeding, when you're brushing, that's your mouth giving you the sign that your teeth are dirty. That's not like you're brushing too hard. A lot of people will be like, oh, I think I'm brushing too hard, or I flossed for the first time and I think I did it too much. And so my gums started bleeding. No, it was because your gums were already inflamed. They're already reacting to plaque in between the teeth. And so you're just disrupting that, and your gums are responding by bleeding. But once you go and you have a cleaning done, especially if it's a professional cleaning or a deep cleaning, you'll start to see a week to 10 days after that the resolve of bleeding gums. You should never be brushing your teeth and you see blood in the sink. That lets you know, like, I gotta go do something. Yeah. And then people always tell me too, they're like, oh, well, what kind of toothbrush should I use? And you shouldn't be using medium or hard. You should just be using a soft bristle. So if you're using a soft bristle brush and your gums are bleeding, definitely that means that you need to go and get a cleaning, and it can probably be reversed.
One of my questions was about the toothbrushes, and like you said, this. So why do people still have, or why does the industry still sell medium and hard toothbrushes?
I don't know. I think it's to clean like the tub. And
Something,
like to get like
toilet,
in between, like, the sink, like when you're trying to get the grout.
Your edges.
Yeah, right. Yeah, edges. Edges. I was laughing too because when she was talking about the Q-tips, I was like sitting there like, well, then why do they sell them then in abundance? And we love them. Like,
no, we know that's like
right.
Clean the babies and the makeup, blah blah blah.
Right, exactly.
Yeah. So I try to figure out why we haven't received a call yet for those who may want to get their child's teeth clean. Once again, the question is, how many full set of primary teeth do children have by the age of 3? If you don't know the answer, Google it. All right.
Listen.
All right. And here's the other question then. We need a second person now. You can't come and answer both questions. It's not going to happen. The other question is very simple, similar to the first one. And this question is courtesy of Premier Dental Group. And the question is, how many permanent teeth does the average adult have? Tony, you know that answer?
Permanent?
Yes.
It's supposed to be.
No,
I was like, what's it supposed to be?
I'm not asking how much teeth your Grammy have. I'm not asking how much teeth your neighbor has. I don't answer the question. I don't know if that's the right answer. Our doctor's here. She's going to give us an answer. But we're waiting for the caller, 328-8164. 328-8164. And let them tell us. And then Doc is going to let them know if they're right or wrong. So when it comes to our family, dental history, what are some of the things regarding our teeth that may be hereditary? Especially what you may see in children. Or maybe it's too early.
There's not that many things that are hereditary other than like enamel defects. There are some perio problems that you may want to ask if there's a history of gum disease in the family. But one thing that people always use the excuse, which again is a myth, is that, oh, my family has bad teeth, or my mom lost all her teeth, or gum disease run in our family, or dentures run in our family, that kind of thing. All of that can be prevented.
Really?
Absolutely.
So if my grandma used dentures, right? Does that mean that I'm gonna end up having dentures?
Absolutely not.
Thank you, Jesus.
Absolutely
Take care of my teeth,
not.
right?
Exactly.
Okay, brush and floss, brush and floss.
Absolutely.
Let's talk about mouth. Oh, we have a caller. Okay, let's go. Good evening, caller. Welcome to your lane live talk show. Sorry. How may I help you?
Good evening.
Hi.
Calling to deal with my trivia.
Yes. Now we have two questions. Which one are you gonna answer?
The one about the children, how many teeth do children?
Yes. How many full set of primary teeth do children have by the age of 3?
Is it 20?
Let's ask talk.
Absolutely correct.
Who are we speaking to?
Yes.
My name is Nadia Dorothy.
Hello, Nadia Dorset. Congratulations. So we're gonna do is we're gonna ask our producer to get your name and contact so that we can tell you how you can obtain your prize,
Child, yeah.
courtesy of My First Dentist. Have you ever went there? Any of your kids ever went there?
Yes, I did visit. The POD before, yeah.
Oh, wow. Well, thanks for coming. We appreciate it.
Thank you. Thanks. And hold on. Let's get your information. So we spoke about that. Let's talk about mouthwash. Because we got the mouthwash that's very, strong. And then you have the mild ones. What's the difference? And you think if something is really strong, that means it's more effective. Is that so?
No, because what you're feeling when you feel as though the mouthwash is strong, you're just feeling the alcohol burn, which alcohol is very drying to your tissues. I'm sure a lot of other physicians in certain circumstances may not recommend alcohol as the best agent to use. But all of that is gimmicky, really, in terms of like toothpaste and mouthwash. All of those tingly feelings are just to make your mind feel as though it's super duper clean.
You mean marketing?
Right.
That's all they're doing.
Pretty much.
Right.
So I always tell people, even like I had a conversation before about toothpaste. So you don't need like a whole heap of toothpaste for your mouth to be clean. You only need about a size of a pea size amount. That's about the amount that you need. Mouthwashes are tailored for whatever it is that you have going on. So you have to kind of read what it is that the mouthwashes are for. Right. One of the things that we don't have in the water here is fluoride. And so I am an advocate for fluoridated mouthwashes because that is what helps you not to get a cavity. Right. So whether or not it's your kids using like fluoride rinse before they go to sleep, or you want like the Listerine, you want to get the Listerine that has like the purple one is the best, that has everything in it that's going to help with gum health as well as like cavities.
The purple Listerine.
Yeah, the purple one, not the brown, right. not the original.
My daddy uses the brown one. Oh my God.
Yeah, not the brown.
How could you put that in your mouth? It's like, no, but yeah. I love Listerine.
Yeah, we love Listerine. We do love Listerine. We do.
So, importance of dental care for pregnant women.
Yeah, because pregnant women. Okay, let's start with a couple things. Baby teeth form in your first trimester, which a lot of people don't realize. So in your first 6 weeks, when you might not even knew you was pregnant, that's when those baby teeth are forming. It's very important in terms of the pregnant woman to be able to have a healthy mouth because there is a link with gum disease and preterm birth weight. So in terms of like, when I say preterm birth weight, premature babies, that's the simple term.
Because of your oral health?
Yes. And so what people don't realize, again, we have a lot of doctors on this show today, is that so many things in your body are linked and they do start in your oral cavity as well. So you could have poor oral hygiene and that could lead to diabetes problems, preterm birth weight, what else? Heart disease. There's just like a plethora of things that they link or poor oral hygiene to. The other thing is people tend to avoid dental care during their pregnancy, but the best time for you to receive dental care during your pregnancy would be in their second trimester. And so you do want to make sure that your oral health is together. You want to make sure you don't have any toothaches because coming down to your your third trimester, no dentist is going to really want to do too much. And then it's also complicated in terms of like what painkillers you want to put in your body when you're pregnant and stuff like that. So you want to prep your mouth just like you're getting ready for your pregnancy. You want to prep your mouth during that time as well. And then women who are like throwing up during pregnancy, you want to make sure that you're kind of doing baking soda and water rinses afterwards to kind of help your enamel not to erode. That can cause problems. And then one of the big things that people don't realize is if you have cavities, you can transmit that to your baby. So you can transmit once you have the baby and you start kissing on your baby and licking that pacifier and blowing on the spoon, whatever bacteria is in your mouth, you can transmit that to your child. Wow. And that is a situation that we talk about because we do have a lot of 1-year-olds, 2-year-olds, 3-year-olds that come in with a lot of decay and their parents are kind of like wondering. But a lot of times there's a transmission of bacteria from the mother to the child.
I did not know that. Tony, you knew that? No. I didn't know that. My final question to you before we get everyone back is what are some natural ways to whiten your teeth? And are there natural ways?
I wouldn't say natural ways, but baking soda and peroxide is definitely an alternative to say a chemical whitening that you would have like in office. That's one of the ways I tell people like start off with regular baking soda and peroxide. If you were to go up from that, other than just saying using that as a natural at-home remedy, then over-the-counter products would be like whitening rinses. Those are really peroxide-based rinses. Even Crest whitening strips, I'm going to use the brand. Those tend to be pretty good in terms of like a starter. Right. What we don't recommend, which is a big, big problem in the Bahamas and actually all over the world, is we don't recommend you go into a non-professional for whitening, which we see a lot of basement whitening. We see a lot of people whitening out of shops. We see a lot of people whitening in their homes. We see in some fake braces being put on. I have to call them fake braces because they look like braces, but what are they exactly doing is a lot of trauma to your health, and people just want to do it because it's cheap. Yeah. You know, and I don't get it because I'm like, I look at people and I say, okay, well, you wouldn't cut corners when it comes to your hair, your nails, your this, your that. But then you want to do some craziness to your mouth that could be irreversible or permanent damage. Okay. I don't think people realize like how much damage can happen if a non-professional is doing like a whitening or braces on you. And we got to fix it. Like once the damage is done, then they come to us like,
okay. Doc, someone's asking, what about the charcoal toothbrush? And I actually heard about the charcoal, like it's in this little container and you dip it in the toothbrush in the charcoal or however you do it, and then you brush this black thing and it goes all over.
Yeah, I've tried it. I haven't noticed that it's so much better than using peroxide and baking soda, but you know, there are charcoal whitening products. We don't necessarily at any of our offices just promote charcoal. Okay. But to each its own, there's no harm in using it. It doesn't necessarily like erode your enamel or anything like that. So if you feel as though using the charcoal is giving you those pearly whites, go right ahead.
You said you tried it though.
I have tried a charcoal toothpaste that had fluoride added to it. I didn't really see any difference, to be honest.
So how can we help with the whitening for our children, our teeth whitening?
We don't really recommend children's whitening for children. Whitening can cause a lot of sensitivity. Mm-hmm. And that's another reason why you need to make sure a professional is doing the whitening, because you can damage your gum tissue. You can damage your enamel. It is kind of like abrasive in terms of the way that your enamel responds to it. So you can have a lot of sensitivity when you're done whitening. So we tend to not recommend it for kids. Just regular cleaning, proper brushing, proper flossing, that kind of thing.
So can we take a break, Tony? We're gonna take a break, but just before we take a break, Dr. Kristen, can you tell us how can we reach you?
Okay, so you can reach me at My First Dentist, which is on Village Road. That number is 393 Kids, which is KIDZ, or 394 Kids. And then I also go to Premier Dental Group, which is a dental group that caters to the entire family. So I go there sometimes, maybe twice a week. And that is at Cable Beach, and that's 605-3368 or 605-3369.
Awesome. We're gonna take a break, and right after the break, we're gonna have the three bosses back. We're gonna bring them back in studio. I know we're short of time. I already getting the stinky eye from producer Tony Williams, but that's okay because we gotta see. This is why y'all need to give me a 2-hour show. Y'all saints, please pray. All right, so we're gonna take a break. I'm gonna bring everybody back in. Stay tuned. Tony, let's hire somebody, man. I need 2 hours. I need 2 hours, Tony.
2 hours?
Yes.
I don't know about that.
Tony, don't let me go to Jesus
Sundays
for
are
you.
down, I want to relax.
I know you
And
want
I'm
to
only
relax.
doing this because of you.
And I appreciate it. Guess what? And I love you for that.
I have,
Listen.
too many hours during the week.
For real, Tony, honestly. You are here. First thing in the morning. First thing in the morning. That's right. So we need to hire somebody to be the producer.
Are
Yeah,
you
man.
experiencing pelvic pain or
That way you don't have to be too stressed.
At Family Medicine Center, we offer state-of-the-art
Over here,
treatment
I'm
for
going to
male
have to
and female
switch
urinary
this
tracts,
camera around.
Okay.
urological diseases,
With
including
everybody else.
non-surgical, minimally invasive
Just let me
options
know
for
when.
medical management of kidney disease, urinary incontinence, overactive bladder, and benign prostate
That's right.
hypertension.
Everybody, because they're just asking a random question and let everyone speak. Tony, we have an audience that says we need 2 hours. Listen to me, listen to me. So what we're gonna do
I
is
didn't prepare the paper.
listen, y'all gonna prepare. This is where our sponsors come in. If y'all want to sponsor the show, come on, let's make it happen. Tony say he expensive. This is one good Sunday.
All you gotta do is put your name here, and in brackets put Apple and put in airborne freight address, and they handle it from there. So how she can get it? Well, she can collect it right at the Lowe's Plaza on Don McCabe Boulevard. Well, how does it work, Nikki? 'Cause I
Someone
never
say send the
can.
bank
That's
information.
what
So
it
we
is.
send the bank information. They ready. Y'all, we gonna get our 2-hour show. Watch, we can get it.
Ladies, your T4 spa day. Skin
We're going to get our 2-hour
is a
show.
serene retreat that is designed to be a relaxation destination. They are committed to giving you personalized service in a clean.
How long have you been doing the show?
This is my 18th episode. So just 18 Sundays. She asked how long I've been doing the show. 18.
Congratulations.
Thank you.
You know,
Thank
you're
you.
like a pro though. Yeah, you're flowing with it. Yeah.
I feel good. Thank you.
You should. You should.
Coach Trish Hannah.
Welcome back. Guess what I have in my studio? Who I have studio? All three of the doctors. Listen, they are bosses in their own respect. I am so grateful to have them. This is like a wealth of information in one spot, minus Tony. I'm joking. So, so listen, we have Dr. Darville, we have Dr. Jackson, we have Dr. McKinney on back with us. And guess what? I had to bring them back because I had to ask a question. First of all, congratulations for having your own practice. Your own practices. Thank you so much for that because you're serving us, Bahamians. You could have, like one of the bios I read, you could have stayed stateside. You could have went any other place, anywhere around the world, but you decided to come back here. And one of the questions that I wanted to ask real quick is, what are some of the challenges, of owning your practice? Let's talk to those who may want to, these up and coming, because these doctors just graduated. These up and coming doctors. Let's talk about real quick, what are some of the benefits and challenges of owning your practice?
Maybe I should take that question after 30 years of practice. I was just having that conversation with Dr. Treasure. You find, I said to her, when you return to the Bahamas, you have to be prepared to work.
Okay.
It's not easy. getting your name out, getting persons to believe in you and want to depend on you for your services. And then, of course, Bahamians, a lot of times they don't think you're worth what you want to charge. That's a major factor. And if you're in a service where you have other colleagues who are much at a lower cost or whatever, then they will figure, or other people who are doing things that, why do I have to pay this amount to see you or whatever? But I was saying to her, you have to educate. We really have to educate our people. And then a lot of people here depend on government services. So if you go into some of the islands to do services where they think it's free or minimal, that's a challenge. But education is key.
Right.
Policies are changing regularly. The world is changing. If we sign on to WTO, that's going to affect the way we practice and what we do also. So there are a lot of different things, but the bottom line is you must be prepared to work and make sacrifices. You will see the results in the long run, and you must be consistent and be dedicated to
I
you.
love that. Let's go with Dr. Kristen, and then we'll go with Dr. Treasure.
Ooh, okay. Well, I'll do it from more so the business standpoint because I've done 2 businesses in the last 6 years. I think that you definitely need to be organized. I think that you need to have a plan. From the professional standpoint, you definitely need to practice standards of care, and you need to stick with your gut, because you'll have patients that will test you. You'll have colleagues that will test you. You'll have just basically, like Doc says, Bahamians are not an easy population to deal with in terms of being a young female. They do feel as though your opinion may be less than some of your male counterparts. And so you just have to stick with being professional, by the book, know what you're doing, stay current, stay very progressive. Don't ever think that it's okay to practice how you did 2 years ago, 5 years ago, 10 years ago, even a year ago. Constantly reinvent yourself. And from the business perspective as well, you want to save for a rainy day. Make sure you have that cushion. Don't live paycheck to paycheck with your businesses. And just constantly think about what you can do to evolve your business. Like, what can I do to make my business better?
Well said. It sounds cliche too, but I think you have to have a growth mindset, and you just have to know what your goals are and what you're working towards. So I think as a young professional too, like I have to assert myself a little bit more. And like she was saying, you have to really know, you have to show them that, you have this education, you know what you're doing, and you present yourself as a professional. So I think, that will help you maneuver with how you interact with patients as well. And then doing business things are always evolving. So you have to be accepting that, things won't run smoothly all of the time. And you have to be open to making changes, reassessing things, and just being open to things not working out sometimes. So I think that also goes into it along with what they said as well.
Another key factor also in our country, because the internet may always not be functioning, the telephone, BPL, these services, you're constantly challenged in terms of equipment and what you're going to buy and those sorts of things. So there are even factors in being in business. That's a reality. Yeah.
Listen, we're past our time, but and so many different questions I want to ask all of you combined, but because of time and because I get into stinky eye, we're gonna cut it. But I need to ask Dr. Treasure, you don't need to tell me your exact age, but let me ask you, are you in your mid-30s yet?
Not as yet.
No.
Approaching.
Ooh, there's hope. There's hope. There's hope for the youngins. There's hope for the youths. And I am so proud of you. I'm very, very proud of you and what
Thank
you're
you.
doing, all that you've accomplished. And one of the questions I guess we can ask afterwards, because what I normally do now is I do like a party after the party. So right after our show with Tony, I'm just going to do a live real quick because one of
Okay.
the questions I wanted to ask you is how you get an audiologist. How out of all the different parts of the body,
Yeah.
you want it right. So that's one of the questions I'm going to ask you afterwards. So I'm going to cut this short simply because of time, but we're going to do a small little live right after on my page, and I want to just talk to the audience real quick. And this is the time when I actually get to challenge my listening audience. And today I want to challenge us women to continue to take care of ourselves. Go get checkups. Do not wait until something is wrong. Prevention is key. Just as we put money aside, as Dr. Kristen said, to license our vehicles or to pay for our insurance and all these other things, we have to place money aside to do annual checkups as well and screening, and not just for us, but also for our children. Right?
Mhm.
And these marvelous doctors that we have here, they cater to both adults and children. I think Premier Dental caters to the adults, and Kristen with First Dental caters to the children. But I can tell you, don't wait until the last minute. If you see a child having issues with reading or having issues with writing, as Dr. Ebbie said, go and check it out. If you have issues or you feel that your baby may not be speaking at the time frame that they should, go and get their ears tested, okay? And just for the sake of it, get your ears tested as well. We should have these things done at least once a year. For our teeth, twice a year, right? And this has nothing to do with what we're talking about, but just as we go into back to school tomorrow, I just want to make sure that everyone have their meal prep and stuff. That way you don't have to stress yourself out, because believe it or not, stress, as each of you stated, has a contributing factor to our health as well. Stress can determine what happens with our teeth, with our eyesight, with our ear and hearing. So try to minimize as much stress as you possibly can. If you got to take out the underwear, the underclothes, take out this whatever school uniform that they have, make sure that shoes are clean the night before. Pack the school snacks in your bag. The water and the fruits and stuff can be done that morning. All right. Simple things like that can help you along the way. And as you're preparing them for school tomorrow morning, try to give them some affirmations, some things that they can say, and allow them to repeat what you're saying so that they can feel better and confident about themselves as they go into the schoolyard. All right. And if you need someone to talk to, or you wish to share your experience, you can email me at coachtrish@yourlanelifecoaching.com. If you need help with coaching in this area, remember, I am still a life coach. You can go to my website, www.yourlanelifecoaching.com. We still have, and we're going to do this on the live. So for those who are listening, go on to Your Lane Life Coaching Facebook page, because we have 2 other giveaways. We have one for
An
Premier
adult,
Dental.
yeah,
And
an
then
adult
what I
clinic.
want to do too is I want to give away, and this is something that's on my heart. I want to give away a pair of school shoes, or two pairs of school shoes, to one parent who may not have received shoes or may not have gotten shoes for their child as yet. All right. And this will be courtesy of John's Shoe Store and Accessories. So with that, because we're leaving, I want you to text me. The number is 376-8689. If you now, this is not for those who already have shoes lined off. Now let's be a little considerate for those parents or this mother who may not have received or gotten school shoes for their child as yet. WhatsApp me 376-8689. The shoes or the gift certificate, you'll be able to get 2 pairs of shoes with that if you desire, would be yours or will be yours, courtesy of John's Shoe Store and Accessories. Today's show is brought to you by Johnson & Johnson, distributed by Lowe's Wholesale, Airborne Freight and Cargo Services, John's Shoe Store and Accessories, Family Medicine Center, Skin Solutions, Day Spa and Salon, Carey's Fabric and Uniform Store, Palmdale Vision Center, My First Dentist Pediatric Dentistry, Premier Dental, and Bahama Herring Clinic. Next week, we are starting a new series on self-development, and we will have, coming fresh out of the topic, setting goals and reigniting dreams that died, with Dr. Melissa Hall. Let me tell you, when I told her about this, the energy from the WhatsApp just jumped off of my phone. Okay. She was so excited. She's so excited. She said, this is so timely, and I can't wait, because I know that she will not only be encouraging me and motivating me, but for each and every one of you who will be tuning in next week. So thank you to my patient producer who've been giving me the stinky eye, but at least he still helped me on. So I say thank you, Tony Williams. I am grateful for you. Thank God for you. Thanks to my Facebook audience. Y'all have been awesome. I didn't have an opportunity to read all of the information that's on here, but yes, these doctors are the bomb, and yes, First Dental is very, very professional. Someone said that people have questions and not enough time, and that's where Tony comes in. I'm saying this live right now. By give me a couple weeks, Tony is going to have me doing a 2-hour show. He said it ain't gonna happen, but how much you bet this can happen? It will happen. I will have my 2-hour show. And so thank you so much for my listening audience. I pray that you were all empowered, educated, and encouraged today. Until next time, have a blessed evening, everyone. Bye-bye. All right, to my Facebook audience, maybe we can I keep this on for a second? Not the radio, but the Facebook Live. Just for 2 seconds. All right, so for my Facebook audience, let's get you. Let me just wait for him to turn it down.
Another wave is coming, but
This is gonna, I think
It's rough.
I don't know if we can stop this from going over there.
Guaranteed to spice up your summer. Just
Ask them if they can hear the commercial.
Can you all have the commercials? Right, just turn it down. Right. Okay, so one of the questions, someone said, thank you, Tony. Bianca Monroe said, awesome show. Thank you so much for listening, but I need to get these questions out real quick. I wanted to ask Dr. Treasure, how did she get into audiology? How?
Okay. It's no special story. I mean, I always wanted to do something in the healthcare field. I don't think traditional medicine is necessarily the path for me, but audiology is more of a helping profession. And then I like the mixture of working with technology as well. So I think it's all a good mix for me as which I like the most.
Mm-hmm.
And then, hearing aids, helping people to hear, it's cliche, but that's rewarding too. So I like all of those things.
Mm-hmm. Okay, see? So all the different limbs and the different things that we have on, she decided to stick with the ears. And that's awesome. So as we are preparing for back to school, doctors, you can answer this real quick because I know we have to go and y'all have to go. I'm very conscious of the time that you have here. But are there any things that you want to note as far as parents who are listening in reference to their children and preparing them for back to school?
Well, vision is one of the requirements for most schools, and most parents tend to go to the GP or to some clinic and have the child look in the screen, or not even a monitor, or look at a chart from the wall. That is not a vision exam, Make sure your child has a full, complete vision exam so that you know their visual status and you know what they will be up against for the school year, because the demand on our eyes are much greater now, and these children are using the digital platform. So to ensure that they do well and to be successful, have their eyes checked, have their hearing checked, and have their teeth and mouth checked.
Mm-hmm. She spoke for you. What else?
She sure did. I'm going to just tap into what I said before. I think that just for overall health, you need to really make sure that your kids are eating a well-balanced meal. Make sure that you're not packing their lunches with junk food. And if you do have a child that's complaining of a toothache, don't ignore it and say that the tooth is just going to fall out, because again, that can affect missing school days and not being able to pay attention and these certain things, and everything is linked. So again, sometimes what they think is a toothache could be an earache and vice versa, and all those kinds of things. So listen to your kids, but also take responsibility as the parent to make sure that you are providing healthy options for your kids and setting the example for them. So don't go eating the chips in front of them or buying the candies and then saying, well, they know how to get it. Well, if you didn't buy it, they wasn't going to be able to get it.
So about the fruit snacks. Let's talk about that real quick, because that's the big thing.
Yes.
But I know the last time I went over to your place, I was told that fruit snacks are not healthy for their teeth.
Right. Fruit snacks are candy. They just are marketed as fruit.
Mom, but it's saying, I don't say the name. 100% fruit. That's what it said on the paper.
Yeah, but it's not. It's not
package.
Fruit though. It's candy.
Oh.
It's
Favorite
candy.
candy.
And it's the same thing with juices. So everything that we put into our bodies, everything. The world is changing. Everything's convenient, but we really have to be aware of what's on the back of the packaging and things that people claim are healthy for us. You have to look at sugar content, additives, all that kind of stuff. All of those things are contributing to just our overall health, the kids' behavior, like being hyper and all those kinds of things. So if you actually take time to really let your child live a clean life and a healthy life, then you'll notice a difference in their overall health and performance.
Awesome. So, Dr. Kenny, this is my final question, and we can go. When you see your child standing in front of the TV and they watching something or they playing a video game and you call them and they're not listening, does that mean that they're just not listening, or they just tuning you out, or you think that there's an ear or they have a hearing problem?
It could mean that they're just ignoring you, but at the same time, there could also be an ear infection, so fluid behind the eardrum, and sometimes even autism. Autism can, that's why they, ask you to get a hearing test done first, because sometimes hearing deficits can sometimes mimic certain things that you see in autistic children as well. And, that plays into their social skills and speech skills and all of that. So sometimes it could definitely mean, more than them just not paying attention to you.
And Trish, if they're standing close to the screen, that's a problem.
That's a problem.
So
come see
manage
Dr.
that time, manage the screen time.
Yeah.
All right. So thank you. We're out. Tony needs to go home. And so we need to just shut it down. We had a really good party today. Thank you so much, ladies, for joining us once again. I am going to send this recording over to each of you so you can have it. Okay. Thank you. And thank you once again to my Facebook audience who stayed back. This is the party after the party. Thank you. Everyone is saying this is a great show. You all did phenomenal. Of course. Yes, because it's Dr. Treasure and Dr. Ebbie and Dr. Kristen, of course. Do you expect anything less? All right. And so I am going to end the show. God bless you. Until next time, have a wonderful evening.
Thank you, Trish.
Thank you.
Thank you,
Thank you,
Charlie.
ladies. It was great.
Right,